A new drug is showing a lot of promise in treating one of the deadliest forms of cancer. A new study found an experimental pill helped patients survive twice as long compared to chemotherapy. One of those patients is former Senator Ben Sasse. In a recent 60 Minutes interview, he called the drug a miracle. Chief Medical Correspondent Dr. Jon LaPook is here to talk about this study. Jon, good morning.
Good morning.
So put this all in perspective for us. Why is this such a breakthrough, and how is this different than traditional chemotherapy?
So it's called daraxonrasib, tough to say, right? And you're doubling the survival time, median survival time, to about 13 months, a little bit more than 13 months, which may not sound like a lot, but if you're going from 6.7, it's a lot to that person.
Sure.
Now, it's not a cure. But the reason why it's so interesting, I heard it got a standing ovation at the national meetings over the weekend, is, traditionally we give chemotherapy. It has a lot of side effects. It affects pretty much the entire body. This is targeted. It was based on a discovery that there was a mutated protein called KRAS that turned on the cancer cells, that it was a cancer-driving type of abnormal protein. And for years, they were looking for a way to sort of turn it off, and they finally figured it out. And this is a first step. It's not a cure, but it's very exciting because you're looking at a new way of treating.
All right, but the reality is there have been cutbacks in research at the National Institutes of Health. So what would that mean for drugs like this in the future?
Yeah, so I looked it up last night. The basic discovery of the KRAS, it's called the KRAS mutation, was more than 40 years ago. It took 40 years ago to figure this out. It's so clever. I mean, there's a molecular glue that figures out how to turn the cancer-causing abnormal protein from the on switch to the off switch. It takes a long time. And when you think about all the cuts that there have been right now, the cuts that are happening right now, I spoke to Randy Bateman from Washington University in St. Louis about research, and he said, it's not like when you stop doing research on your construction on your kitchen, you run out of money, you say, okay, in 6 months I'll pick it up. It's more like stopping feeding a baby. And the research we don't do today is going to affect drugs 30, 40 years in the future.
Wow, all right. Dr. Jon LaPook with that great news. Thank you very much.